You're muted.
Okay. Let the record show that this is not my official rebuttal to the affirmative. First and foremost, I'd like to introduce the fact that the affirmative did not propose a plan. According to Modesto Junior College, the NFA LD rules clearly state that the topical nature of the proposed plan as an inductive proof of the resolution. The affirmative is required to propose a plan that meets 4 initial burdens. The plan need not be detailed, but should be sufficient enough to prove the plan's propensity to solve the problem area. The affirmative failed to do so in the sense that they only outlined the benefits to immigration and not proposing a solution. The affirmative must prove 4 things: the harm of the present system, or that a comparative advantage or goal can be achieved over the present system; the inherency which prevents solving these harms or achieving those advantages or goals; the proposed plan's propensity to solve the harm or achieve the advantage or goal claimed by the affirmative; and topical nature of the proposed plan as an inductive proof of the resolution. If, at the end of the debate, the negative has convinced the judge that the affirmative proposal has violated the parameters set by the resolution, then the decision in the debate should be awarded to the negative. However, the plan does not need to deal with all possible problem areas suggested by the resolution. Topicality is a voting issue. This would be the case if the affirmative proposed a plan. However, they did not do so again. Counter proposals should be logically consistent with all other negative arguments constructed during the debate. If inconsistencies arise and the affirmative points them out, the judge should reject the arguments inconsistent with the counter proposal. Counter proposals are subject to the same burden of solvency as are required of the affirmative plans. Now, as they outlined the benefits to immigration and based on health-related grounds, we'd like to introduce the fact that countries that did have the most strict COVID guidelines came to be the most successful when it came to closing their cases. Not closing their cases, however, flattening the curve in their countries. So New Zealand, for example, became COVID-free as a result of COVID border closure. On February 2nd, a man in the Philippines became the first person outside of China to die of COVID-19. At this point, there were no reported cases in New Zealand, but the next day the country began banning entry to any foreigner coming from or via China. Any New Zealander returning from China had to isolate for 14 days. Jacinda Ardern, who was the Prime Minister of New Zealand, took the unprecedented step of closing New Zealand's borders. As the virus spread globally, a flight ban was also extended to Iran, the origin of New Zealand's first case, and restrictions placed on anyone arriving from South Korea, Northern Italy, or who were first showing symptoms. As of midnight on March 16th, everybody, including New Zealanders, had to go into self-isolation on arrival of the country, unless they were coming from the largely unaffected Pacific Island nations. Prime Minister Jacinda said these were the strictest regulations in the world, for which she would make no apologies. Then, a few days later, Ms. Ardern took the unprecedented step of closing the borders entirely to almost all non-citizens or residents. Doing this early on, as she stated, with only over a few thousand cases worldwide at the time, allowed them to basically stop the influx and stop the community transmission. An economist at the BBC. I would like to state, I do realize that I did not include a source, so my source for this information is BBC News. Additionally, in response to the new outbreak, New Zealand introduced a lockdown in its largest city, Auckland, according to the official government website, and restituted level 2 precautions throughout the rest of the country. Google data shows that New Zealanders have followed the lockdown rules with a remarkably high level of behavior change. Activity dropped almost instantly by over 90% of baseline levels in some categories. That, in conclusion, led to a leveling off of cases in just 10 days after lockdown measures were put in place, he said. Following this, New Zealand was able to go back to business as usual, with even holding large gatherings, and their economy didn't take as much of a hit as other countries. Singapore, on another note, additionally, according to Wired UK, the vast majority of Singapore's positive coronavirus cases, 54,505, have happened within its migrant worker dormitories. More than 320 migrants in jobs such as construction and engineering live in cramped employer-provided accommodation, sleeping in bunk beds, and sharing facilities. In Singapore's experience dealing with SARS, H1N1, and influenza meant it closed its borders early and focused on human-led contact tracing. Similar measures were taken by South Korea, Japan, China, and Taiwan. Early in the pandemic, Singapore's human contact tracing was recognized as highly effective. Additionally, fast forward to the present day, Singapore has reported fewer than 390 cases and had 0 deaths until Saturday, when it confirmed its first 2 fatalities since the outbreak began there in late January. According to CNET, Singapore's relatively low rate of infection came through a potent combination of early and intensive policy intervention, including shutting its borders to Chinese travelers on February 1st, roughly a week after China announced it would lock down the city of Wuhan. With new coronavirus cases having increasingly increased in every country, it's far less compared to countries like Italy that saw a spike in cases in the thousands. New York City, which has a similar population size and density to Singapore, has nearly 4,000 cases, despite confirming its first case on March 1st, 2020, more than a month after Singapore, which confirmed its first case on January 23rd. The contrast is staggering, and it comes at a time when the world is grappling with the rapid spread of coronavirus. Thank you.
Okay. The first thing I noticed about the affirmative side is that they did not give a plan, whether that plan is completely thought out of or if that plan is just an idea. They didn't give a plan at all. In answer to the affirmative argument side, though, the affirmative argument is that if we remove health-related grounds, then it will help immigration move quicker. Removing health-related grounds would only be a small portion to the immigration problems and not resolve much. A quote from Lona Bray on Nolo.com: "You might not be allowed to enter or remain in the United States if you have what's known as a Class A condition, which means you have a disease of public health, lack required vaccinations, have or had a physical or mental disorder that causes you to engage in behavior that might be harmful to yourself or others, or have a history of drug use or addiction. The medical exam will also look for Class B actions, meaning serious in degree or permanent diseases. Although they likely won't make you come into the United States, they can be considered significant enough to interfere with your ability to care for yourself, attend school, or work, where they might be required extensive future medical treatment or the raises of separate concerns. They will be found to be likely public charge, or someone will not be financially self-efficient but instead rely on government assistance." So this quote is saying that not only will you not be able to get in the United States, but they will have to take action into if you are extremely ill. And that is a problem because a lot of people can't get a lot of health benefits outside of the country. Sometimes people come to the country to get those health benefits. The second affirmative argument is regarding F1 visas. With most schools going online due to COVID-19, there's no reason for the F1 visas. On an article titled "The F1 Visas Explained" on boundless.com, there's a quote that says, "Because there are so many courses and places to study in the United States, the F1 visa has a pretty broad application, but also some very clear rules. The first is that you have to be coming to the United States with the intent to temporarily study. In other words, this is not an immigrant visa. So this means that people not only are reading this application and signing it and saying they agree to the terms, but they also are reading the terms that in case of anything does happen where they can't attend school in person, this isn't an immigration visa, this is a visa just for school. And that means that they can't stay. You also must be studying at an academic institution, not training in a school, as this requires of an M1 visa, which is a completely different visa. Your academic institution must be approved by the Department of Homeland Security through the Student Exchange and Visitor Program, meaning it needs to be addressed to be able to accept a foreign students on F1 visas. You will be able to work, but because of this non-immigrant visa, you will be restricted to where you can work and the type of work. Finally, although your spouse and children can come with you, they will not be able to work, but your children can enroll in schools. They will be on F2 visas and tied to your visa status. A disadvantage to this would be that immigrants come from a country with bad healthcare, and so that is why they're coming to the United States, as I stated earlier. In Chapter 3 of an article on uscis.gov, it states, even if the applicant is not subject to health-related grounds, the officer may still order a medical examination as a matter of evidence indicates that there may be a public health concern. This could apply, for example, when an officer states a request for parole. In general, an immigration officer may order a medical examination of an applicant at any time if the officer is concerned that the applicant may be medically inaudible. This rule applies regardless of the type of immigration benefit sought or whether the applicant is applying for a visa, seeking entry in the United States, port of entry, or already in the United States. So this could be a problem because many people might be coming to the United States to gain that, to get extra help with their health issues and need that extra help that they can't get in their other country. And by stopping them from coming in because of this can cause them to not get any better and maybe get more people sick throughout the whole world, which can also cause the United States because people travel and some people could travel to this area that has a lot of sickness and come home and bring it into the United States. All immigrants need to be tested properly and correctly, or it can risk an outbreak in the United States. Chapter 4 from an article on uscis.gov states, since a State Department consular officer reviews the medical documentation completed by a physician as part of the overseas visa process, an officer may assume that the medical documentation is properly completed. This means that they have to get seen by a physician in the country that they already live in and get approved by that physician and give it to the the officer when they enter the United States. The officer is going to assume that this is a legal documentation, but it not always can be legal, which is a problem with the health related grounds. There needs to be some kind of better indication that this is a real form and that they didn't get this forged or see a physician that's maybe not licensed to be doing this. Counter plan. The plan is to keep medically checking people and making sure they are healthy before allowing them to come into the United States. This is important so it can keep the United States safe from any harmful diseases or etc. A quote from chapter 1 of the website uscis.gov states the medical grounds of inaudibility, the medical examination of aliens and the vaccinations to aliens are designed to protect the health of the United States population. The immigration medical examination, the resulting medical examination report, and the vaccination record provide the information USCIS uses to determine if an alien meets the health related standards. Public health concerns have been reflected in the United States immigration law since the Immigration Act of 1882. So this shows that we've always just wanted, at the end of the day, important health for the United States, and that's why we keep health related grounds. And thank you.
Okay. Health-related grounds of inadmissibility matter. They are specifically put into place in order to protect the people of the United States. This is why the U.S. must uphold their policies on immigration even during the COVID-19 pandemic. In this refutation against the affirmative, I want to focus on an argument that was discussed by the affirmative on students with F1 visas during the coronavirus pandemic, followed by why it is important that our country has these health-related grounds of inadmissibility and how little the change in immigration rates would be even if health-related grounds of inadmissibility were taken out of the picture. To begin with, I want to focus on one specific argument that was mentioned in the affirmative speech, which was the fact that many foreign students with F1 visas are being forced to leave or are prevented from entering the United States because of the coronavirus pandemic. So first, I wanted to explore what it means to hold a non-immigrant status, and according to the UC Berkeley International Office, this status is for people who enter the US on a temporary basis, whether for tourism, business, temporary work, or study. Once a person has entered the US in non-immigrant status, they are restricted to the activity or reason for which they were allowed entry. So non-immigrant status essentially means that they can only be in the United States because they are permitted to be there for a specific reason. If they are no longer there for that reason, then they lose that non-immigrant status and can no longer stay in the United States. And this brings me to my next point, which is that the visa has no purpose and is no longer valid anymore if the student is taking online courses. According to Ilona Bray from NOLO, one of the key features of the F1 visa is that you are expected to come to the United States as a full-time in-person academic or language student enrolled in a program leading to a degree or certificate. An online study is limited to one class or 3 credits per term. So the whole point of the F1 visa is to attend a school in the United States in person. Anyone could attend an online school anywhere, and since most schools are going online, there's no point behind the F1 visa anymore, and there's no point in these students staying in the US. For my final point on this subject, I want to bring up the fact that the Student and Exchange Visitor Program actually modified their exemptions to help students with F1 visas in the face of this situation. According to the official US Department of Homeland Security website, due to COVID-19, the Student and Exchange Visitor Program instituted a temporary exemption regarding online courses for the spring and summer semesters. This policy permitted non-immigrant students to take more online courses than normally permitted by federal regulation to maintain their non-immigrant status during the COVID-19 emergency. The SEVP program instituted a new policy in order to help these students keep their non-immigrant status. These students were given an exemption for the disadvantage they were facing in order to make the process easier for them. So they weren't just left to deal with this themselves. In the end, these were necessary actions taken towards those trying to come into the United States and towards those already in the United States, especially given the standards and requirements that are listed for F1 visas. It is important to also remember that a green card or certificate of citizenship is needed to permanently stay in the US. So these actions were not only necessary, but also valid in order to follow policy. Health-related grounds matter because of diseases like COVID-19. In order to prevent epidemics in the US for diseases that we already know about and have what is necessary to prevent them. Moving away from the subjects on the affirmative, this argument revolving around COVID-19 actually leads me to one of my off-case arguments, which is that COVID-19 was recently added to the health-related grounds of inadmissibility. So once again, according to Ilona Brea of NOLO, a list of these is kept in the Code of Federal Regulations, and they can be added to by presidential executive order or by the Centers for Disease Control, which keeps a list of quarantinable diseases. The main ones on the list are active tuberculosis, various venereal diseases, and infectious leprosy. COVID-19 or coronavirus has been added to the list of quarantinable diseases. So COVID-19 is a global disease, and that has affected and still continues to affect millions of people worldwide. And getting rid of health-related grounds would expose more people to COVID-19. This would immediately increase COVID-19 cases and cause more epidemics to occur for those not vaccinated yet. It would be way more difficult to get out of this pandemic with more people that are infected freely coming into the United States. Taking away these grounds of inadmissibility would not only increase the diseases and viruses that enter the United States, but will also allow people from countries who continue to struggle with the coronavirus pandemic into the United States. And then another important point that I wanted to make was that there are a bunch of other grounds of inadmissibility. Sam Moser of VisaPlace states that according to the Department of Homeland Security website, travelers may be denied entry to the U.S. for the following reasons, and this includes they previously worked illegally in the U.S., suspected of overstaying their visa, they're suspected of having ties to terrorist or criminal organizations, they previously overstayed a visit to the U.S., they don't have sufficient funds to support themselves during their stay in the U.S., inadmissible health, being convicted of a criminal offense. And so health-related grounds of inadmissibility affect immigrants all the time, but for a necessary reason. Even if everyone was on board with getting rid of health-related grounds and they were completely taken out of the immigration policy, because there are so many grounds of inadmissibility, getting rid of one will make little to no difference at all. Not only that, but disease would be very prominent in the US. What would happen if we got rid of health-related grounds would be even worse than how it already affects immigrants. Immigrants who have diseases or are sick upon entry would spread that sickness to the citizens of the United States. There is no huge long-term impact when it comes to the change in immigration rate. That's one of the outstanding problems with the affirmative argument. However, sickness and disease would spread in the United States, and the citizens would be in constant fear of epidemics or the possibility of another pandemic like COVID-19. Our safety would be non-existent in a country full of disease, and there would probably be a lot more deaths. To conclude, I want to emphasize again how important health-related grounds of inadmissibility are to the safety of the people in this country. Our protection is jeopardized and we become extremely vulnerable without these grounds. COVID-19 put a huge weight on everyone, not just immigrants, and we all struggled from the presence of this disease. After everything that has happened in the past year, it should be very clear and obvious why it is essential that health-related grounds of inadmissibility should remain, which is to prevent what COVID-19 brought to the United States. Health-related grounds of inadmissibility matter, and it couldn't be more clearly needed than now.
Okay. So, for my refutation, the tests that the United States are conducting are necessary to ensure the health, both physically and mentally, prior to entering the U.S. So prior to entering the U.S., I found it from the website my20usa.com. Prior to entering the United States in an immigrant status or seeking adjustment of status AOS in the United States, all applicants for admission undergo a health screening. The non-citizens has been determined relying on applicable regulations of the United States Health and Human Services (HSS), current on the day such determination is made, to have a communicable disease of public health significance. The individual seeks admission as immigrant or seeks adjustments of status to the status of an alien lawfully admitted for permanent residence and has failed to present documentations of having received required vaccinations against vaccine-preventable diseases. The individual have been determined relying on the applicable HSS regulation in operation on the day when the determination is being made, to have physically or mentally disorder and behavior associated with the disorder that may or has posed a threat to the property, safety, or welfare of this individual or others, to have had a physical or mental disorder and a history of behavior associated with the disorder when such behavior has posed a threat to the property, safety, or welfare of this individual or others, and which behavior is likely to recur, which will lead to other harmful behavior, to be a drug abuser or addict. For more information on it, and for my disadvantage, immigrants are more prone to sickness because some have limited access to health care and more and mostly from less fortunate places. Some people come to the United States because they want to, like Bree said, they want to gain, they want to have the health care the United States provide. In ncbi.nlm.nih.gov by Clark Ava, the intra intra cases of poverty, limited access to healthcare, and fear of legal repercussions place vulnerable immigrants communities within the U.S. at high risk for acquiring SARS-CoV, the COVID, and developing severe COVID-19. The lack of readily accessible, affordable health care is particularly consequential during the COVID-19 pandemic. First, early diagnosis and monitoring of persons with COVID-19 is critical both to optimize the individual patient's outcome and to prevent further community transmission. Regarding risks of SARS-CoV-2 exposure, immigrants are at increased risk both because their economic situation requires continuation of work despite social distancing and stay-at-home recommendations, and because that the types of jobs most commonly worked by immigrants often require face-to-face interactions. Another disadvantage is a failure to submit required health documents can result in being denied entry to the United States. If you're applying for an immigrant visa, you are required to be vaccinated for several diseases, including mumps, measles, rubella, and polio, among others. In order to avoid the need to be vaccinated at your immigrant medical examination, you should bring a copy of your vaccine records with you as a proof of past vaccinations. If any of these required vaccinations are not received, you will be deemed inadmissible. However, some vaccinations are not required if they are not age medically appropriate. For instance, certain vaccines are not medically appropriate during pregnancy, known as medical contraindication. In this case, that vaccine requirement will be waived as not medically appropriate. If immigrants are not tested properly, it will cause more problems to the United States, since there are already millions of people who need healthcare, and due to COVID, it has rapidly increased. Thus, there is much concern that the COVID-19 pandemic will result in particularly high rates of unemployment and financial strain within immigrants' communities. Between February 2020 and April 2020, the unemployment rate from immigrant women increased from 4.3% to 18%, and for immigrant men from 3% to 15.3%. While for U.S.-born women, it changed from 3.3% to 15.3%, and for U.S.-born women, it increased from 4.3% to 12.8%. As the COVID pandemic causes instability in global supply chains, concern of worsening food insecurity is growing in many disadvantaged communities. Immigrants are at particularly high risk, especially those who have resided in the U.S. for less than 5 years. This may be because immigrants' families newly arrived in the U.S. have more significant language barriers and less exposure to a stable education system and jobs than those who have lived in the U.S. for longer periods of time. And to be able to ensure that someone is healthy and coming to the United States, they should be going through the whole medical examinations to ensure the safety of everyone. During the immigration medical exam, the doctor will perform a physical examinations and review your medical history, vaccinations, records, and lab results. Individuals who are in the United States and applying for adjustment of status will need to make this appointment with a USCIS designated civil surgeon. For those who are applying for immigrant visas through consular proceeding at a U.S. embassy or consulate abroad, a visit to a DOS-approved panel physician is required. In conclusion, we have to have a healthcare ground because we are not sure if those people who are planning to come to the United States is as healthy as they claim to be.
Okay. Can you guys hear me okay?
Yes, we can hear you.
Okay. Okay, so I will be arguing against the health-related grounds affirmative case, who did not propose an efficient plan to lift the restrictions regarding health barriers of immigrants. I will also argue how health restrictions should not be seen as discriminatory, but rather specifically to keep the country healthy while reducing the amount of disease and viruses from spreading. I will also discuss the importance of restrictions due to COVID-19, as well as F1 visas for students. We will be discussing 2 on-case and 3 off-case components. So first, in response to the COVID-19 issue, limitations related to COVID-19 should be carried out in a non-discriminatory way, but focused on protecting the health of the United States and reducing the overall number of cases. So in an article from the United Nations Network on Migration from March 2020, they stated, as the world confronts the COVID-19 pandemic, the United Nations Network on Migration salutes the immense efforts to date to combat this crisis and urges that all, including migrants, regardless of migratory status, are included in efforts to mitigate and roll back this illness's impact. To that end, migrants must be seen as both potential victims and as an integral part of any effective public health response. Basically, we must continue to take strong measures against fighting the pandemic and keeping the numbers down as it is constantly spreading, especially across borders. And in response to the affirmative stating that many healthcare workers are born outside of the United States, although there may be a number of healthcare workers who were born outside of the United States, this does not exactly mean that they're still not bringing in infectious diseases. So in an article from Brian Gushalak in, called The Globalization of Infectious Diseases, he wrote, in most immigrant source regions, infectious diseases continue to represent major causes of death and morbidity due to respiratory infections, gastrointestinal diseases, tuberculosis, and HIV infection. So these are just some of the diseases that have been known to spread as a result of immigration. When referring to the effectiveness of the affirmative plan, I'm unable to find a clear alternative or plan. The affirmative states that there needs to be some sort of resistance that exposes certain myths about migrants. However, there's factual evidence relating to the importance of health restrictions and how disease has spread through immigration. As a counterplan, in order to improve health management and conditions, travel patterns must be redesigned, more coordinated international actions must be taken, and more education enforced. In an article from B.D. Gushalak and others from March 2010, they stated to improve global health management and preventive health practices, there's a need for coordinated international actions and partnerships, organizations, and nations and destination. Also, better understanding of the nature of the health aspects of migration can help prevent some adverse health outcomes. So in addition to this part of the refutation, it is known that migrants play a significant role in the spreading of diseases and illnesses. In an article from M. Hong and others in September of 2017, they wrote, there's a premise that migrants and refugees have an acquired infectious disease rate higher than that of host populations in developed countries. There's also the complexity of reintroduction of communicable disease in a disease-eradicated community, which can occur with a new influx of refugee migrants. Furthermore, environmental infrastructure and lifestyle play an important role in disease transmission. And lastly, in response to the F1 visa argument, we found that most schools have been transferring to virtual learning as a result of the pandemic. So there would be no specific reason for the F1 visa. So in an article called The F1 Visa Explained from boundless.com, it states, because there are so many courses and places to study in the United States, the F1 visa has a pretty broad application, but also some very clear rules. The first is that you have to be coming to the United States with the intent to temporarily study. In other words, this is not an immigrant visa. So this is a visa for school, which is clarified with other rules prior to receiving the visa. Overall, it is shown that migrants are actually causing the spread of disease rather than helping it, and there must be a properly proposed plan to keep restrictions in order to provide a safe and healthy environment. Thank you.
Hello everyone, timer starting now. So it's crazy people want everyone to come and go fly around everywhere, even though we're in the middle of a pandemic. Like, why would you want the disease spreading? On top of that, the affirmative did not at all propose a proper plan, because the official decision-making paradigm of the NFALD is that stock issues are advantage or goals inherent are sorry the paradigm of NFALD is that stock issues, including harm, inherency, solvency, and topicality, are required to properly properly make an affirmative argument. The affirmative is required to propose a plan that meets four initial burdens. The plan need not be detailed, but should be sufficient to prove the plan's propensity to solve the problem area. Number one, the affirmative must prove A, the harm of the present system, or that a comparative advantage or goal can be achieved over the present system. B, the inherency which prevents solving those harms or achieving those advantages or goals. C, the proposed plan's propensity to solve the harm or achieve the advantage goal claimed by the affirmative. And D, the topical nature of the proposed plan as an inductive proof of the resolution. If at the end of the debate the negative has convinced the judge that the affirmative proposal has violated the parameters set by the resolution, then the decision of the debate should be awarded to the negative. However, the plan does not need to deal with all the possible problem areas suggested by the resolution. Topicality is a voting issue. Number two, the negative may attack any of these issues, but need only win one to win the debate. Additionally, the negative may argue that one or more disadvantages of the proposed plan outweigh its benefits. The negative may also present one competitive counter proposal specific to the affirmative problem area and not dealing with the form of government, economic system, or a need to further study, unless it's specifically identified as a key issue in the resolution. Number three, counterproposals should be logically consistent with all other negative arguments, especially during the debate. If inconsistencies arise and the affirmative points them out, the judge should reject the arguments inconsistent with the counterproposal. Counterproposals are subject to the same burden of solvency as are required of affirmative plans. Now on to answering what we have so far of the affirmative argument. The affirmative argument is that if we remove health-related grounds, then it will help immigration move quicker. Removing health-related grounds would only be a small portion to the immigration problems. It would not resolve much. You might not be allowed to enter or remain in the United States if you have what's known as a Class A condition, which means you have a communicable disease, of public health significance, lack of required vaccinations, have had a physical or mental disorder that causes you to engage in behavior that might be harmful to yourself or others, or have a history of drug abuse or addiction. Even if you have never been diagnosed with an alcohol or drug related health issue, a record of alcohol or drug related arrests, for example, a DUI, or criminal offenses can result in your being found inadmissible on health related grounds. There are waivers available for all health related grounds of inadmissibility except drug abuse and addiction. The medical exam will also look for Class B conditions, meaning serious in degree of permanent diseases or disabilities. Although they likely won't make you inadmissible, they can be considered significant enough to interfere with your ability to take care of for yourself, attend school or work, or they might require extensive future medical treatment or institutionalization. This raises a separate inadmissibility concern that you will be found to be a likely public charge or someone who will not be financially self-sufficient but instead rely on government assistance. The second affirmative argument is regarding F1 visas, which, with most schools going online due to COVID-19, there's no reason for the F1 visas. What is the F1 visa? The F1 visa allows a student to temporarily live in the United States for a defined period of time while studying at a school, college, seminary, or conservatory. Is the F1 visa right for me? For many students, the chance to study in the United States is the culmination of years of hard work and dedication. Unless the person is already a U.S. citizen or green card holder, all prospective students will have to apply for a visa to study in the United States. Because there are so many courses and places to study in the United States, the F1 visa has a pretty broad application, but also some very clear rules. The first is that you have to be coming to the United States with the intent to temporarily study. In other words, this is not an immigrant visa. You must be studying at an academic institution, not training at a vocational school, as this will require M1 visa. Your academic institution must be approved by the Department of Homeland Security, the Student Exchange and Visitor Program, meaning it needs to be accredited to be able to accept foreign students on F1 visas. You will be able to work, but because it's a non-immigrant visa, you will be restricted to where you can work and the type of work. Finally, although your spouse and children can come with you, they will not be able to work, but your children can enroll in schools. They will be on F2 visas and tied to your visa status. Ultimately, stick around, stay at home, just go on Zoom. Why do you need to come to America to go to school? I mean, like you got online classes. Just do those. I'm done.